Vitamin D is an extremely important vitamin that has powerful effects on several systems throughout your body. Vitamin D functions like a hormone, and every single cell in your body has a receptor for it. The recommended daily intake, RDI, is usually around 400 to 800 IU, but many experts say you should get even more than that. Vitamin D deficiency is very common. It's estimated that about 1 billion people worldwide have low levels of the vitamin in their blood. Here are 8 signs and symptoms of vitamin D deficiency. Number 1. Getting sick or infected often. One of vitamin D's most important roles is keeping your immune system strong so you're able to fight off viruses and bacteria that cause illness. If you often become sick, especially with colds or the flu, low vitamin D levels may be a contributing factor. A number of studies have found that taking vitamin D supplements at a dosage of up to 4,000 IU daily may reduce your risk of respiratory tract infections. Number 2. Fatigue and tiredness. Feeling tired can have many causes, and vitamin D deficiency may be one of them. Case studies have shown that very low blood levels can cause fatigue that has a severe negative effect on quality of life. The study found that women with blood levels lower than 20 nanograms per milliliter or 21 to 29 nanograms per milliliter were more likely to complain of fatigue than those with blood levels over 30 nanograms per milliliter. Number 3. Bone and back pain. Vitamin D helps maintain bone health in a number of ways. For one, it improves your body's absorption of calcium. One study examined the association between vitamin D levels and back pain in more than 9,000 older women. People with vitamin D deficiency were nearly twice as likely to experience bone pain in their legs, ribs or joints compared to those with blood levels in the normal range. Number 4. Depression. A depressed mood may also be a sign of vitamin D deficiency. In review studies, researchers have linked vitamin D deficiency to depression, particularly in older adults. Some controlled studies have shown that giving vitamin D to people who are deficient helps improve depression, including seasonal depression that occurs during the colder months. Number 5. Impaired wound healing. Slow healing of wounds after surgery or injury may be a sign that your vitamin D levels are too low. One study on people who had dental surgery found that certain aspects of healing were compromised by vitamin D deficiency. It's also been suggested that vitamin D's role in controlling inflammation and fighting infection is important for proper healing. Those with severe vitamin D deficiency were more likely to have higher levels of inflammatory markers that can jeopardize healing. Number 6. Bone loss. Vitamin D plays a crucial role in calcium absorption and bone metabolism. Many older people who are diagnosed with bone loss believe they need to take more calcium. However, they may be deficient in vitamin D as well. Low bone mineral density is an indication that your bones have lost calcium and other minerals. This places older adults, especially women, at an increased risk of fractures. Adequate vitamin D intake and maintaining blood levels within the optimal range may be a good strategy for protecting bone mass and reducing fracture risk. Number 7. Hair loss. Hair loss is often attributed to stress, which is certainly a common cause. However, when hair loss is severe, it may be the result of a disease or nutrient deficiency. Hair loss in women has been linked to low vitamin D levels, though there is very little research on this to date. Number 8. Muscle pain. The causes of muscle pain are often difficult to pinpoint. There is some evidence that vitamin D deficiency may be a potential cause of muscle pain in children and adults. In one study, 71% of people with chronic pain were found to be deficient. Vitamin D deficiency is incredibly common and most people are unaware of it. Fortunately, a vitamin D deficiency is usually easy to fix. If you think you may have a deficiency, it's important that you speak to your doctor and get your blood levels measured. Also, you can try to increase your sun exposure, eat more vitamin D-rich foods, such as fatty fish or fortified dairy products, and take vitamin D supplements. If you like the video, give it a thumbs up and share it with your friends and family. For more tips, subscribe to the channel.